school attendance and birth weights fell in the months immediately following the introduction of income management measures as part of the Northern Territory intervention, two new studies have found. The research by the University of Sydney and the Menzies School of Health Research found that rates of school attendance fell an average of 2.5 percentage points, or 4%, across the 73 remote Aboriginal communities and 10 town camps put under compulsory income management in the 13 months from September 2007 and October 2008. The average birth weights of babies who were in utero in the same period fell by 100 grams, and the probability that babies would be born with a low birth weight, less than 2.5 kilograms, increased. Researchers say the results have raised concerns about the potential for similar negative consequences from income management under the cashless welfare card. Birth weights are a key indicator of child health, which is, along with school attendance, was one of the key areas the intervention was designed to improve. Associate Professor Stephanie Schuer said the results were unexpected, and could not be explained by confounding factors such as increased smoking or drinking among expectant mothers or increased transience among community members with school-aged children. There was no recorded change in smoking or drinking rates among mothers that may have affected birth weights, or community movement that may have affected school attendance, during the relevant period. Schuer said researchers had expected to find either no impact, or a positive impact. Both studies suggest that an increase in household stress caused by the introduction of income management measures could be linked to the negative outcomes. Survey data from the longitudinal study of Indigenous children taken from the same period showed that mothers reported an increase in being humbugged or hassled for money from other family members. It also reported an increase in children being upset by family arguments. Schuer suggested that the disruption to family finances caused by having 50% of their fortnightly welfare payments quarantined to spend on basics, such as food and clothing, may have caused conflict in household, and that the poor implementation of the income management scheme, which saw confusion over how to access funds and was not user-friendly, could also have added to stress. The program evolved into the Basics card, but when it was first introduced it required the use of gift cards and accounts with community stores that made it difficult for people to access their money. Sylvia Pereira-Neal, an Eastern Arrernte woman who spoke at a forum in Redfern on Friday on 10 years under the intervention, said income management did help people ward off humbugging but had been imposed without consultation and without the option for people to opt out. Of the 15,125 people placed under mandatory income management in the territory, only 649 or 3% were granted an exemption. The older people could appreciate how it could work, and I know a few people have said that, and I'm sure it's not uncommon, says Neal. But the fact it was dictation, you do it. We're not stupid people. The government needs to bloody learn to negotiate. I know it's a new thing for Australia. Schuer said it was possible the negative consequences seen in the NT could occur with the cashless welfare card. The Turnbull government is currently trying to drum up crossbench support for legislation that would allow the cashless welfare card to be rolled out anywhere in the country. We can't say for certain that if you roll out the cashless welfare card in Seduna, one of the trial sites, that it will have the negative impact on birth weights, because we don't have that data, she told Guardian Australia. But we can't say for certain that it does not have the negative mechanisms that we saw in the Northern Territory and the stress factors we saw there. The cashless welfare card quarantines 80% of the income of a person on welfare within a particular group or community. It has been in operation as a trial in the East Kimberley region of Western Australia, and Seduna in South Australia, for a year. Schuer said the government's evaluation of the trial in the form of a qualitative survey was mixed. Extraordinary controls or extraordinary measures require extraordinary evidence, and it's not there, Schuer said. The cost of administering the income management scheme introduced during the intervention is estimated to be $20,000 per participant. In the cashless welfare card trial it was $10,000 per participant. It's really expensive to run income management, she said. You pay $20,000 to administer a program to put $250 per fortnight into a different account, and it may have potentially negative impacts. It doesn't strike me as a very strong policy. Professor Sven Silberg, from the Menzies Institute, said the cashless welfare card was an improved model, saying, I think as an opt-in model it has benefits. But he said that the government would get better outcomes in the areas that both policies were designed to address, alcohol and drug abuse, and poor child health, by putting the money spent on administering income management schemes into proactive assistance. For example, he said, you could improve child nutrition by granting families extra money that could only be spent on food, rather than quarantining an already small income. If you are wanting to change behavior, incentives always work a lot better than negative reinforcement, he said. The intervention is still in place in the territory. Sparked by a series of news reports alleging child abuse in remote communities, it was approved by federal parliament in July 2007 and required the suspension of the Racial Discrimination Act, because the measures specifically targeted Indigenous communities.